We're standing by for the press conference at the National Crisis Management Centre. I believe that's just underway. Let's cross now to it live.
When Whakaari White Island erupted. I'm joined today by Ashley Bloomfield, the Director General of the Ministry of Health, Deputy Commissioner John Timms from New Zealand Police, and Graham Leonard from GNS Science. This morning we were hopeful that we would be able to recover bodies of the people who unfortunately lost their lives on the island. However, this has not been possible due to the conditions on the island, and Graham Leonard from GNS Science will have more on this. The Ministry of Foreign Affairs and Trade are working on determining the status and identification of foreign nationals that were believed to be on the island at the time of the eruption. And the Ministry of Foreign Affairs and Trade have deployed a team of 3 to Whakatāne to support diplomatic missions of affected foreign nationals. Te Puni Kōkiri are engaging with Te Runanga o Ngāhi Awa to provide support and information to family and whānau of missing persons. Ngāti Awa Social Health Services, also called NASH, the Bay of Plenty Welfare Coordination Group and the Bay of Plenty District Health Board are working together to coordinate welfare services delivery through local staff and services through the Ngāti Awa Social Health Services. Bay of Plenty Civil Defence Emergency Management Group are focused on providing welfare support for victims, survivors and their families, and information is available at the Civil Defence Centre at 4 Commerce Street, adjacent to the Whakatāne District Council, and we know that families are expected to begin arriving in Whakatāne from today. We are currently focused on ensuring families of the injured and deceased are supported on arrival into New Zealand. Immigration New Zealand are assisting through border clearance processes and connections to police family liaison services. People travelling from countries other than Australia will require either a visa or a New Zealand Electronic Travel Authority, and full information about this is available on immigration.govt.nz website. Immigration New Zealand will identify these applications from families and expedite these. The National Emergency Management Agency has issued an all-of-government fact sheet for public use, providing all the details that people might need following the event. This is on our website, civildefence.govt.nz, and has been shared across agencies. Before I hand over to Ashley Bloomfield, I'd like to address the matter of recovery of the bodies. This is an utterly tragic situation. We all agree that retrieving bodies of the deceased from the island is an absolute imperative. Every day that passes with those bodies unrecovered is a day of anguish for their loved ones who have been affected. We recognise this and we are doing everything we can. I personally met one of the families yesterday and they are devastated. So I completely understand how important it is for them and for each of the other families affected by this tragedy that we undertake that recovery process as quickly as we can. However, the preservation of human life and the prevention of further human harm must be taken into account. This tragedy has already claimed multiple lives and caused terrible injuries and unspeakable grief. There is always a delicate balancing act when it comes to recovery operations of where risk to human life exists. And right now, the science tells us that this is just too high. I can assure you that risk is constantly being reassessed because everyone, and I want to repeat that, I mean everyone is united in the desire to recover those bodies from the island so they can be returned to their loved ones. Thank you, and I'd like to hand over to Ashley Bloomfield to speak first.
Kia ora koutou. Thank you, Sarah. So I'm Dr. Ashley Bloomfield, Director General of Health. Just want to make a few quick comments about the picture for those who are injured and being cared for around the country. Earlier today, we formally activated what is called the National multiple complex burn action plan. This is the first time this has been activated in a unique situation where we have a number of very seriously injured people in our regional burns units around the country, as you will know, and we have our national burns unit at Middlemore Hospital in Auckland that has now taken over essentially the overall control of the care for those patients and the coordination across the country for where those people are cared for if transfers are required, and also to lead the clinical decision making about possible repatriation of those injured people. In particular, back to Australia, as we have had an offer from the Australian Defence Force and the Australian Government to repatriate Australian injured people over the next day or two. There is a further video and media conference at 5:30 this afternoon in Auckland, and subsequent media conferences about the status of those who are injured and any intentions around repatriation. Those conferences will be led out of Middlemore, but as I say, there is one at 5:30 today. As at this point in time, the status of or the distribution of patients who are injured we have 7 patients at Middlemore Hospital in the National Burns Unit, 4 patients at the Burns Unit in Hutt Hospital, 2 patients at Auckland City Hospital, 2 patients still remaining in Tauranga Base Hospital, 6 patients are at Waikato Hospital, 8 patients at Christchurch Hospital, and 1 is at Wellington Hospital, and in fact that person is in the process of being organised for transfer back to Sydney through a private company here, and the conference at 5:30 can give you more detail there. So once again, there will be regular updates on the status and disposition of those who are injured, and that will be led out of Middlemore Hospital, the National Burns Unit, as we have now activated the National Multiple Complex Burn Action Plan. Thank you.
Thank you, Ashley. I'd now like to introduce Graham Leonard from GNS Science to provide the science update.
Kia ora, my name's Graham Leonard. I'm a senior volcanologist at GNS Science. There's been further escalation in the volcanic status overnight and today at Whakaari White Island. So what does this current situation mean on the ground? There are 2 key risks. First, environmental. Now, this is highly wind varying, but at times it will be challenging for breathing, seeing or walking on the island, and at other times clear. Second of all, there is the risk of another eruption, like Monday's eruption, while on the island. As of 11 a.m, our expert elicitation estimates a risk of, or a chance of 40 to 60% of another eruption like Monday in the next 24 hours. That's up slightly from 30 to 50% yesterday, but monitoring parameters are escalating now and since then. Tremor on the island, seismic signals on the island are escalating at the moment. This compares to a 0.1 to 0.2% chance of eruption that we estimated while we were at Volcanic Alert Level 1 back on the 29th of October. In summary, yesterday there was a high risk of an eruption. Today there is an even higher risk of an eruption. And the parameters are worsening at the moment. Also, I'd like to point out that we monitor gas in the sky above the volcano, and this is to help us understand the magma situation at the volcano and inside the volcano in the ground. Separately, gas, where people would be on the ground on the island if they were there, is different. It's monitored differently and handled and assessed very differently, led by the police. Through the Science and Technical Advisory Committee, we provide some advice into that, but that includes other aspects around human health. GNS Science and the GeoNet Volcano Monitoring Group are currently analysing the state of the magma system within the volcano, and we will provide an update this evening. Thank you.
And if I can now hand over to Deputy Commissioner John Timms from New Zealand Police. John.
Thanks, Sarah. Kia ora. Afternoon, everyone. Firstly, can I just say that my sympathies go out to family and friends today. This is an absolute tragedy, and so my thoughts are with them all, as the 14,000 members of the New Zealand Police, their thoughts go out to the family and friends as well. Can I first say, police are absolutely committed to removing the bodies from the island for family and friends. We have sought advice on the current environment, the requirements of those going to the island, and the care and transportation of bodies from when they are recovered. The environment on the island has changed. Increased activity since early this morning, and you've heard from our scientists about that. We are standing by to go back to that island. The resources are at Whakatāne. As soon as we are confident that there are no risks and that those risks can be managed when we return to that island, we will do so. As you've just heard, GNS has advised us that further eruptions is likely, and it is too dangerous to return to the island at the moment. Since Monday, we have been working tirelessly with our partners at Defence, Fire and Emergency New Zealand to establish a plan for the recovery of the bodies still on the island. We are confident on our ability to deliver the rescue operation, but that is after we are sure that we can manage the real dangers that are on the island. These are the dangers that our people and emergency services people would face. Those deployed would face serious physical and chemical hazards, and we must be prepared for that. As part of the recovery, we have disaster victim identification specialists in Whakatāne ready to be deployed. DVI is a skilled role that must be undertaken with the utmost care and consideration. We understand and appreciate the desire of the family and our community for the bodies to be recovered as soon as possible. And it is our number one priority. We will return to the island, we will recover the people there. Today, we are able to release the names of those who have been identified or confirmed as missing. Those names will be on our website shortly. An Australian Defence aircraft is heading to New Zealand now to uplift a number of the injured Australians. We also have members of the Australian Federal Police here supporting us, supporting the families here from Australia, and so we appreciate the support from Australia and the work that those here on the ground are doing. The drone that conducted 4 flyovers of the island earlier today, the analysis of that footage that was taken is ongoing. Finally, can I just say that I want to acknowledge our people, emergency services, those members of the community that are working hard every day. I'd like to thank them for their efforts, commitment and passion, and as I've said, our number one priority is to return to the island and recover those bodies. Thank you.
And that was Police Deputy Commissioner John Timms.